There are several treatment options for benign prostatic hyperplasia. We offer green light laser therapy, which is a standard of care. Excess prostate tissue, mainly around the urethra, is removed with a laser through the urethra. The disadvantage of this method is that a man loses his ability to ejaculate physiologically. There is another method that we use to treat prostate adenoma, but we are not its authors. The technique is called rezum and it is based on the use of steam. The principle of this therapeutic procedure is as follows. The prostate is approached through the urethra with an applicator, and then the prostate is treated with water vapor without damaging the urethra. The rezum procedure allows doctors to relieve pressure on the urethra from the outside, allowing the patient to normalize urination. The procedure also makes it possible to preserve ejaculation. That is why the rezum technique is very popular and highly effective. We have slightly modified this procedure. As a rule, the rezum procedure is performed endoscopically, practically blindly, because the doctor can only see the surface of the urethra from the inside. We perform the manipulation under the control of rectal ultrasound, thanks to which we can clearly see where exactly the applicator is located. We also perform an MRI before the procedure. This allows us to better study the anatomical structure of the prostate gland and thus better control the progress of the treatment. Surgical treatment for prostate adenoma is not performed. There is an option for transurethral resection of prostate adenoma using laser techniques or an electrical loop. The second option is the easiest. I have already mentioned that the incidence of complications in the form of problems with ejaculation after the rezum procedure is much lower than when using other methods that also affect the urethra. It is also necessary to take into account other possible complications, such as bleeding. And it should be noted that when choosing the rezum technique, other complications are much less common than when using other procedures to reduce the volume of the prostate through the urethra.